The practice of calcium therapy. Take one. Oh, that feels good. Yes, we want to talk about calcium therapy and how we practice it and how we cure periodontal disease. We're going to start with our little reading that just we're going to start some sessions on this, and we'd like you to know about it. It'll be on the website very soon here. Calcium therapy is available in the dental office and at home. Join us in February, maybe the near into February. There are free sessions at calciumtherapy.com. All sessions are online, and about once a week, a session is the next session is posted on Calcium Therapy's website, and will stay online for your convenience. Write us on an email of questions, and we'd be glad to answer them for you or find the answer. These are short videos that explain and demonstrate how it's done in the dental office or at home. There's so much of it that can be done at home to preserve the gums, the bone, and the teeth. Now, calcium therapy has been around about 50 years, and it is safe, it is sound, it is non-invasive. That's really important. Periodontal treatment. And it applies to all of the fields of dentistry. You can use it in any field of dentistry. Well, mm@calciumtherapy.com. Call us or if you're interested. And it's based on this manual. Oh, there you go. We did this about 20 years ago or so or more, and it's been updated. So let's start with the applying the calcium therapy material. Okay, there are a lot of ways to apply it, but this is where we started, and it was a simple way to start, and we still do it every day. This is a Hollandbeck, I think we call it in dentistry. See the thin ends that it's there, it's very thin and blunted. We use it for putting in things, and we use the calcium material that's here. There's a couple, that's 2 mixes, and so we take a blunt instrument, and there's others you could use, and we mix up the materials and take it with your Hollandbeck or whatever your little thing is, and you put it on the gum right next to the tooth, right on the gum right next to the tooth, and you'd take your lip and hold the lip against that to flatten it out real good, and then it kind of breaks up, and you take the blunt point and just tease it in between the teeth and under the gum. That's crucial. In between the teeth, under the gum, there's always a little room there, and you don't use a whole lot. You notice how we could use that one mix there. We could use that for 10 teeth, see? It's usually an area that's sore, so you can do that. Okay, this material, there's a lot of different kinds of these, and we've used about every one of them, and they're in tube like this. It's a 2-component mix of calcium, material. It's not calcium hydroxide. Throw that away. It's calcium materials, and there's a lot of them. 10 of them you can get. And if we wanted to treat the whole mouth quickly, we can use, here's what, just to show you, there. See, that's what you call a Jiffy Tube. It's an instrument dentists use, a little tube that you can squirt out the calcium. And so you go and you squirt little here, little there, little there, and you get several teeth, and you can go all the way around the mouth. In fact, with that full a tube, that small a tube, you get, this will come later in the sessions here. You can take this and full and do the whole mouth in about 30 seconds, maybe 32. And that's how you apply this. But in the beginning, it was those, and then we learned how to get this to the public, anybody that was at home and needed help, is the chips. Now, see how thin that is? We make it real thin in one piece, but then as it comes to you in the mail, you know how they play around with the mail, of course, chips up. It gets to be small chips. Well, that's what you want, is small chips. Then you take a little saliva and take a little of this and put it up on there, and you kind of gently rub it in, and it catches in the teeth. And so then you take any kind of thing like the Hollandbeck that I showed you, but these we send with you. See how this is blunted here? We try to blunt that, or you can blunt it yourself, and take that little instrument and tease it, remember, in between the teeth, under the gums, very gently. And you only need about 2 or 3 of those little chips in the tooth, because if you put it into the teeth and you put it here, in 4 seconds, it's all the way around the tooth. You don't have to put it on out here in the tongue side or in here on the cheek side, because if you put it right here and right here of the tooth, it gets around so fast. It's a very dynamic system. And the chips were something advanced in that. Well, we've got something else that is advanced from there, and that is the strips. And again, they're in little packets where you take the little folder, and you can see how they're stuck on there. Well, you take one off and you put it up under here, right where you would the other way, and put it along the teeth, and it lays there like a wad of gum. And you can keep that there for hours. And those are the ways that we practice this. Now, so if you have any questions, sure, write us, send us some information that you're interested. And the important thing with what we're doing here is do it. Don't talk about it, do it. And you will see what happens with these materials. And if it wasn't any good, I wouldn't be using it 50 years later, right? So the next thing I want to talk about is we're getting in deeper and more that you can do at home. Do it for this week or so, and just see how it works on you, on your patients. I'll tell you, they'll love you for what that, because this eliminates periodontal surgery. Right there. This eliminates it. There are other causes. There's 4 causes. This is one of them. Another cause is traumatic bite. Now, real quickly, when you have trouble with the bite, you can find it very easily, and you can explain it to your patients. You say, Gertrude, you have a bite, and I'm going to show you how it sounds. This is the sound of your bite. Yeah? Okay. Oh, it goes. It's kind of like this is a tune, Beethoven or the Beatles. Dum-dum-dum-dum. That's your bite. And that happens in a millisecond, Gertrude. But what we need to have is a unified bite, an integral bite, all at once. Very powerful, very comfortable. Well, we're going to go into that next time. So thanks very much for coming, and learn some more later. Try this, learn some more later of the practice of calcium therapy.